Today I want to have a conversation about societal equity and the relationship it holds with people with disabilities. The Centers for Disease Control and Prevention reports that more than 1 in 4, or 70 million American adults today, have some form of a disability. My friends, if we examine the notion of pulling out a chair of inclusion at the table of equity for the special needs or disabled population, it's clear that there's more work to do and more conversations to be had to fully ensure that that segment of our population is fully heard, respected, and valued. The good news as we start this week is I'm excited to bring you a conversation that I had with my friend Devon Wieters. She's a college graduate, a writer, and a podcaster who happens to have cerebral palsy, but that's only a portion of her story. She's a fierce advocate for disability rights, specifically advocating for the passage of the SSI Restoration Act, which would eliminate the Social Security and Medicaid marriage penalty and the SSI Savings Penalty Elimination Act, which would raise the salary and asset limits on Social Security for people receiving Medicaid. I asked Devon about the practical implications of living with a disability, what it means for people navigating a world where they have to encounter obstacles each and every day, and the sentiment of hope and what it means for folks with disabilities moving forward into the future. I'm Kevin McShann. Let's have this conversation. Devon, if you're ready, I'll take a moment to welcome you to the program, my friend, and I'm super excited to learn about your story of excellence and difference, my friend. It's great to see you on this Monday, and good afternoon to you, my friends.
Great to see you. How are you? Thank you for having me.
Absolutely, Devon. And Devon, I wanted to start by asking you a broad-based question to tell me about your story of difference and impact, my friend, because I know that we both have cerebral palsy, but that's just a part of our collective story, my friend. So I want you to tell me all about yourself. I know you're a writer, an advocate, and everything in between, my friend. So tell me about your story and point of difference, my friend.
I'm all of those that you just said. My main advocacy point right now is to eliminate the marriage penalty and raise the salary and asset limits for Social Security and thus Medicare and Medicaid, so that more people can keep their benefits and not have to worry about choosing between their jobs and their health insurance. So that's basically what I've taken up the mantle of, so to speak.
Yeah, absolutely. And Devon, I know that over there in the States that Social Security, Medicaid, and Medicare is under attack because of the current administration, and I know it's something you're keeping a close eye on for people with disabilities because their lives will be dramatically affected. So I'm curious to ask you about the state of sort of play for folks with disabilities in America now, because it's certainly a challenging time to navigate, isn't it?
Well, the fortunately, the long-term care Medicaid and Social Security haven't been affected too much. So,
Not yet, right? Yeah.
so yeah, yet, but I don't think it's going to be affected. The long-term care thing's going to be affected too much. It's just the most challenging thing to navigate is the same thing it's been for 40 years, the salary and asset limits and marriage penalties. So.
And for those watching, tell me about the importance of advocating for getting the marriage penalty lifted and all of the things that come with that, because people shouldn't have to choose between their job, getting married, and medication. So tell me about why this is so personally important to you, my friend.
So, yeah, like you said, people shouldn't have to worry about having a normal life and getting their medication paid for. People shouldn't have to choose between that, and people shouldn't have to choose between being on the benefits they need to pay for said wheelchair uh, and personal care aid and all that, and working. So that's the salary and asset limits part of the equation. And so, yeah, people should not have to choose between living a normal life and their health insurance and security benefits. So.
Yeah, absolutely. And, you know, Devin, I always say that living with cerebral palsy or any sort of disability provides you a different sort of perspective on how to view the world and all it has to offer, my friend. So I'm curious to now ask you, how has having cerebral palsy sort of changed your view of the world, and why is living with the stigma that comes with a disability harder to do today itself? I'm curious about what your thoughts are on how we eliminate the stigma of living with a disability to open up doors of inclusion for folks with disabilities. What are your thoughts there?
So, I think part of how we eliminate the stigma is putting them to work, which means raising the salary and asset limits, because, again, it's very emotionally draining to have to explain to people, no, just because I'm in a wheelchair doesn't mean that I, you know, have a cognitive disability, or it doesn't mean that I can't have kids if I want them, or it doesn't mean that I'm like somehow lucky because I get to roll around in one of these things and not have to walk. I mean, I wish I could walk, but can't, so I have to use one of these things. Um, but I think as we start putting them to work and they start working in normal work environments, some of that will go away. So.
Yeah, so let's talk about opening up or paving a pathway to a sort of employment equality. What do you think is the key to sort of building bridges of opportunity for folks with disabilities within the workforce? What are your thoughts there?
Well, I am going to sound like a broken record, but we need to make it possible for them to work. So we need to raise the salary and asset limits and more work from home jobs. I know employers are like weird right now about work from home, and rightfully so. But for people with disabilities, transportation and personal care attendants being an issue, it's just easier for them to work from home. So more work from home options, and like I've said like 6 times already, raise the salary and asset limits, and I think a lot of the rest of it will fall into place.
Yeah, and Devin, one of the things I wanted to talk to you about when it comes to salary and asset limits, because Devin, I live in Canada, and the social sort of service model here is if you have $40,000 in any one bank account, the government of Canada think you're rich, and that they start removing sort of the salary and the benefits that come from a medical perspective, because the government then thinks since you have that much money in a bank account, you can live independently, and the protections or the sort of uh, the services that the government provides slowly goes away. So it's a bit of a deterrent for people with disabilities to work. And I know in the States, you're fighting to relieve those penalties. So tell me about the importance of societal inclusion and why you believe that sort of eliminating those barriers is an important step to not only provide them with the financial security and the benefits that come with that, but also the societal sort of component to that as well. What are your thoughts there?
So the current, well, first of all, I talked to another guy from Canada, but he lived in a hospital though, so he, like a hospital setting, so
Mm-hmm.
he might have been a little different, but he said it was $200 in a single month that you couldn't make. So I'm glad it's 40,000 in the bank account and not $100 in a single month.
Mm-hmm.
Um, so that's twice what we have here, or well, no, like 20 times what we have here, because our limit is $2,000 in one bank account in the U.S. And anyway, I think the current system um, traps people. It's designed for people to become dependent on it because you can't work because if you make any money at all, basically that you have to come out the benefits and you won't have enough to pay for it out of pocket still. So I think it's uh even if it was unintentional, it's designed to keep people dependent on it, and I think we need to make it designed to make less people dependent on it and have it be a helping hand when they need it and not like a permanent trap. You know what I mean?
Yeah, absolutely. So, Devin, what do you think it means to you to provide people with disabilities both dignity and independence within their societal life? What do you think that means to you, my friend?
So I'm gonna sound like a broken record, but let them live normal lives. Like again, raise the salary and asset limits so they can work and not have to worry about losing their Medicaid. Bring the exorbitant prices of power wheelchairs and accessible vans down. I mean, I know they cost money to make, but it's still such a financial burden to be able to get one of these chairs and one of these vans so that they could go out and live a normal life. Um, Realize that a lot of them are super smart, smarter than you and I combined, a lot of them. And, and, realize that they have the same dreams that an able-bodied person does. Want to get married and have a family and all that. So
Yeah, and Devin, I know that you host a podcast, my friend, called will, my friend, or you interview people from all walks of life to gain a better sort of wisdom and understanding and perspective of their journey in the community, no matter where they live or come from, my friend. So tell me about the show and its mission, my friend.
Well, you just described it pretty well, but the mission is basically I'm a very curious person naturally. And when I saw Survivor and Jeff Probst, and he was fielding questions at Tribal for the first time, I'm like, I want to do that, whatever that is. And so that's where I learned my interview skills. I wish I was joking, but I am not. That is where I learned how to interview. I didn't go to interview school. I just watched Jeff Probst for about 20 years, and then decided to. And then I was listening to this other podcast called Bob Has a Podcast. If you like reality TV, you should listen to that because they cover all things reality TV and they're hilarious. And so I said, how hard could this be? And the answer is very. It's much harder than I thought. And so it started as a Survivor recap podcast. And let's just say recapping Survivor every week, even just the new episodes was a lot of work because you have to get all these little details. So I just moved over to interviews and that's what I'm doing now.
Yeah, and I'm curious, what has been the most fascinating thing that you've learned about the perspective of other people when it comes to interacting with people with disabilities? What do you think is the most interesting thing you've learned, my friend?
So, the most interesting thing I've learned, just in general, is like I have some people on that have been through so much, and I'm like, how do you get out of bed every day? Like, I'm complaining about little things, and I'm like, how do you get out of bed every day? So I think those are the ones that stick with me the most, or people that have been through horrible things and still can talk about it.
Yeah, so for you on a personal level, how would you define your why in life? Why do you get out of bed and advocating every morning, Devon? Why is life important to you?
So that's a question I've never really been asked before, but I think I do it so that hopefully 40 years from now, the next generation of people in my position won't have to. They could just, not have to worry about choosing between their benefits and their life, basically. Because if nobody does anything, then this problem's going to continue for the next 60 years because it's not a top issue that many Americans think about because most Americans are able-bodied, and rightfully, that's not what they're worried about. So I think that's what keeps me going. So the next generation won't have to deal with what previous generations did. So
Yeah, absolutely. And Devin, what is the concept of a fully inclusive society means to you, where people of all strengths and abilities can thrive? And what do you think of the phrase equal opportunity means to you as well?
so putting people, I sound like a broken record, but this is what I advocate for. So you're going to hear it about 5 more times in this podcast, I think. No, I'm kidding. But you're going to hear it just one more time at least. Making sure that they're in a position where they don't have to choose between their health insurance and making too much money at their jobs. The disability community is the only community that says, I can't do that. That's too much money. So, giving them the opportunity to make more money without sabotaging the help that they genuinely need, I think is my definition.
Yeah, and definitely if you had a message to lawmakers or decision makers that are making these decisions, what would your message be and why?
Um, so I think a lot of people mistakenly assume that if we raise the asset limits, more people are going to abuse it. And yes, there is abuse, but the way the benefits are currently structured, the people that they're benefiting most, I'm not saying people with disabilities aren't being helped at all by the current system, but the people that are um, benefiting the most are the people that want to abuse it because they don't care what the asset limit is. So if you raise the asset limit, it'll allow people that genuinely need it to work and keep their benefits and not just sit there and do nothing because we want to work and be able to keep our benefits.
Yeah, and living with a disability, this is something that um, I contend with on a daily basis, as I'm sure you do, because, Devin, I always say that, uh, you know, smarts is an equal opportunity sort of a contributor, but sometimes, access to opportunities isn't when it comes to both employment and social inclusion as well. So, what are your thoughts on how we can create more social capital or social opportunities for folks with disabilities to thrive? What are your thoughts there?
So, first of all, we need more accessible public transportation that doesn't cost an arm and a leg. For example, the waiver that I'm on, I'm moving soon, so this problem is going to be rectified soon. But the waiver that I'm on, where I currently live at my parents' house, um, you're supposed to be entitled to something called paratransit. It's free, accessible public transportation to wherever you need to go. The catch is as long as it's in the service zone. And my parents' house is not in the service zone, so I haven't been able to do it. So I like to see it where, um, and this is more of a state issue. This is not a federal issue as much. Um, if you're on the waiver, you get paratransit, period. So I think the number one thing for social is more accessible transportation that'll allow people to get out and socialize.
Yeah, absolutely. Devin, I'm going to end on a two-part question, my friend. I'm curious to get your definition of what progress looks like. And when your final days commence on it, my friend, I'm curious to ask you about a legacy and how you want that to be defined. So, what does progress look like for you, and how do you define legacy, my friend?
Progress looks like more people are talking about this issue, which we've gotten, thankfully. Yay. There was a recent hearing that brought up in Congress in the US that brought up these very issues. So I'm very excited about that. And I'm not a big legacy person. I don't know what my legacy is going to be. I guess that remains to be seen, but I hope um, that the reforms are passed in my lifetime, and I can say that I was a small part in getting the reforms passed. I think.
Yeah, absolutely. And Devin, I lied. I have one more for you, and I'm curious because the CDC reported last year that over 70 million U.S. adults have some form of a disability, and over 40% of them live in some sort of social isolation. And one of the things that I wanted to ask you about is the idea of universal sort of understanding and how we get more people to understand sort of the day-to-day challenges, successes, and the life of people with disabilities. So how do we get more, I hate to use the term able-bodied, but how do we get more people to understand how they can be an ally of support to the more than 70 million U.S. adults who are currently living with a disability? What are your thoughts there?
Well, I don't know. I guess we need to get more people with disabilities in media. Um, if you have not watched Patrice the movie on Hulu, I imagine it's available in Canada. Please go do so if you have a Hulu subscription. That is an awesome movie that covers a lot of the issues that we talked about. Um, and yeah, I just think people need to like make friends with the person with a disability and get to know them. And then that'll open up some doors for, greater understanding.
Mm-hmm. And Devon, finally, tell me if people want to get connected with you, my friend, what's the best way they can do that?
They can go to wheelwithit.com and all of our podcast socials are on the homepage, and then my social media is under the About section. Um, and we also have a whole page on what we're trying to do with benefits reform, as well as a criminal case with a guy that we believe was wrongfully convicted of murder. We have a whole page about that as well. And so they can go there and check all that out, and all that information will be on there. And I have a place where they can contact me via email. And so it's all on there if they would like to go to that.
Well, fabulous. Well, Devon, I want to applaud you for your obvious passion and dedication to advocacy, my friend, and for giving a voice to those with all types of disabilities and social situations. You're really doing yeoman's work of good, my friend, and I want to thank you for being here and engaging in conversation with me this afternoon. It's most appreciated.
You're welcome. Thank you for putting up with the technical difficulties. You have been such a amazing host. So this has been one of my favorites I've done, honestly.